Welcome to the Biopharma Business Intelligence Unit, where symbolic integrity meets strategic clarity. At BBIU, we go beyond the headlines to decode the structural forces behind global biopharma, AI, and economic realignment. If you value precision, verification, and symbolic depth, this channel is for you. Subscribe now to access our weekly briefings, dossiers, and intelligence reports, and consider joining our institutional tier to unlock early warning systems, custom metrics, and exclusive strategic insight. You're not just listening, you're entering the future of epistemic intelligence. www.biopharmabusinessintelligenceunit.com.
Low back pain and herniated disc, anatomy, pathophysiology, causes, and treatment. 1. Anatomical framework. The lumbar spine consists of 5 large vertebrae, L1, L5, designed to bear most of the body's weight. Between each vertebra lies an intervertebral disc composed of annulus fibrosus, concentric collagen and fibrous layers that preserve disc integrity and stability. Nucleus pulposus, a gelatinous, water-rich core that functions as a hydraulic shock absorber. In the lumbar region, directly in front of the spine are vital retroperitoneal structures, great vessels, abdominal aorta, and inferior vena cava. Segments of the duodenum and the pancreas. Ureters descending parallel to the psoas muscles. Loops of small intestine in variable contact. From the spinal canal emerge nerve roots, converging to form the lumbosacral plexus and ultimately the sciatic nerve. This proximity explains why disc pathology often translates into neurological symptoms. 2. Low back pain, definition and spectrum. Low back pain, lumbalgia, is pain localized in the lumbar region, ranging from benign to life-threatening etiologies. Benign mechanical, muscle or ligament strain, postural overload, micro-injuries. Degenerative, progressive disc dehydration, facet joint osteoarthritis. Compressive, disc herniation, lumbar spinal stenosis. Severe structural, vertebral fractures, osteoporotic or traumatic. Infections, spondylodiscitis, spinal tuberculosis, primary or metastatic tumors. Absolute emergency, cauda equina syndrome, massive compression of nerve roots causing incontinence and motor deficits. 3. Herniated disc, pathophysiology and clinical features. A herniated disc occurs when the annulus fibrosus tears, allowing the nucleus pulposus to protrude or extrude, contained protrusion, local mechanical pain. Nerve root compression, radiculopathy, sciatica. Chemical irritation, pro-inflammatory mediators amplify pain and neural sensitivity. Symptoms depend on the level involved. L4, anterior thigh pain, diminished patellar reflex. L5, lateral thigh and leg pain, weakness in foot dorsiflexion. S1, posterior leg pain, reduced Achilles reflex, weakness in plantar flexion. 4. Causes of low back pain, ordered by severity. Muscle or ligament strain, fatigue, poor posture. Mechanical postural overload, sedentary lifestyle, obesity. Disc degeneration, loss of hydration, disc height reduction. Herniated disc, nerve compression, sciatica. Facet joint osteoarthritis, posterior joint wear. Lumbar spinal stenosis, bony narrowing of spinal canal. Vertebral fractures, osteoporosis, trauma. Infections, bacterial spondylodiscitis, spinal TB. Vertebral tumors or metastases. Cauda equina syndrome, surgical emergency. 5. Treatment, stepwise approach. Step 1, self-care and initial measures. Relative rest, avoid prolonged bed rest, local heat, walking, stretching. Postural hygiene, avoid long sitting, adjust ergonomics. Step 2, medical therapy. Analgesics and NSAIDs. Muscle relaxants in acute spasm. Local or epidural injections for persistent pain. Step 3, rehabilitation. Physical therapy, massage, mobilization, deep heat ultrasound. Core strengthening to stabilize the lumbar spine. Postural re-education, therapeutic Pilates, yoga-based rehab. Step 4, interventional procedures. Nerve blocks, epidural steroids. Minimally invasive options, radiofrequency ablation, nucleolysis. Step 5, surgery reserved for severe cases. Microdiscectomy, removal of herniated fragment. Laminectomy, decompressed spinal canal and stenosis. Spinal fusion for severe instability. Prevention, long-term. Regular physical activity, weight control, no smoking. Core stability programs, ergonomic adjustments. 6. Structural and symbolic perspective. The lumbar spine is more than a set of bones. It is the architectural foundation of mobility and stability. Low back pain often mirrors structural overload, mechanical, metabolic, and societal. A herniated disc represents the rupture of a biological shock absorber, translating stress into pain and dysfunction. Understanding the anatomy and pathophysiology demystifies fear, Most back pain is benign, yet red flags, motor deficit, fever, weight loss, incontinence require urgent medical attention. Conclusion: low back pain spans a continuum from trivial to catastrophic. The essential task is to differentiate common benign pain from warning signs, applying a graduated treatment ladder that emphasizes conservative care while reserving surgery for true emergencies. BBIU commentary: clinical perspective. In my medical practice as director of a CPA clinic, I have consistently observed that patients with constipation or excessive intestinal gas report more intense low back pain. My working hypothesis is that intra-abdominal pressure generated by retained stool or gas directly impacts the lumbar spine. When the patient defecates or expels the retained gases, the pain often subsides temporarily. This leads me to emphasize that each patient's metabolism is unique, and long-term improvement requires habit modification rather than just symptomatic treatment. 3 points are central. Hydration. Increase daily intake of water, not soda, coffee, or tea, plain water. If drinking larger volumes is difficult at first, adding a splash of lemon or orange juice can help until the habit stabilizes. Dietary awareness. Not every food benefits everyone equally. Pay attention to which foods cause bloating or gas in your case and eliminate them from your diet. This self-monitoring is often more effective than generic advice. Periodic deworming. At least twice a year, the whole family should undergo safe, simple, and inexpensive deworming. Reducing parasitic load decreases eosinophils and consequently lowers the body's baseline allergenicity. Taken together, these adjustments highlight that managing back pain is not only about the spine itself, but also about systemic balance. The lumbar column reacts not just to mechanical stress, but also to the internal environment shaped by metabolism, digestion, and immunity.